Hey, it's Dr. Lipari again, Jacksonville Center for Reproductive Medicine. We are continuing our series on in vitro fertilization and pre-implantation genetic testing of the embryo. In the last series, we talked about how do we get to the day 5 embryo and why do we culture embryos to day 5. And in this series, we want to talk about how are these embryos graded and how does an embryologist tell us which embryo we should transfer versus those we should kind of wait on. So this picture is actually one that shows us two really nice blastocyst embryos. So the blastocyst is the embryo that we see typically on day 5 or 6. And the embryo at that point in time has transitioned into what becomes the baby, which is this part inside the circular structure. This is called the inner cell mass. And the outside of the embryo is called the trophectoderm, and those cells actually become the placenta. Those are the cells that produce HCG, which we measure in the blood when we try and determine whether someone's pregnant or not. All right, so pre-implantation genetic testing is the procedure where the embryologist is able to sample the cells that become the placenta. So those ones that we just talked about called the trophectoderm. Basically, the embryologist is able to take a sample of about 5 of those cells and send them to a genetics lab, so that way we can tell the karyotype of the embryo. Karyotype is like how many chromosomes an embryo contains. Most people will kind of look at those to determine whether or not an embryo should be transferred or not. So in the next series, we're actually going to talk about who should do PGT, or should we do it at all? Does it hurt the embryo to do that? And is there a particular age criteria that we should use to encourage patients to use that?